Good afternoon. My name is Mark Strand from North Dakota State University and one of the participants in the 1RX program. Welcome to our virtual coaching call on implementing 1RX in your practice. As I mentioned, my name is Mark Strand, and today I'm joined by Amy Wermeyer, Associate Professor in the NDSU School of Pharmacy, along with what we've affectionately called our 1R experts, Sarah Schmidt and Jamie Vandervorst, both working in Thrifty White Pharmacies in Grand Forks and Mandan, respectively. We've found since 1RX training was begun on October 1st of last fall, and then implementation in the pharmacies in the middle of October, we found that pharmacies have had different paces of implementation as they've enrolled in the program and begun to provide screening and care for patients receiving opioid prescriptions. But there's always lots of lessons learned as one implements a new type of workflow and patient care, and so we've designed these 1RX coaching calls in order to provide personal and timely information to try and help people maybe share experiences or get over the humps. This call should be helpful. We'll be talking about, we'll spend about at most 30 minutes on this call. We'll do a 5 to 10 minute introduction with some pearls and nuggets, and then we'll have 20 minutes or so for interaction and conversation among our participants. So you're already connected in, so I assume that's no problem. And okay, here are the objectives for today. As I mentioned, discussing lessons learned and explaining the workflow, and then have opportunities to discuss successes and barriers to starting the 1RX. So as an update, as of on Monday, we had 517 screenings completed around the state. 13.2% were identified as having opioid use disorder red flags. 27.5% were identified as at risk for an accidental overdose. 85% of patients were introduced to the take-back program, and 4.3% of patients were dispensed naloxone, which is a significant increase from what's been seen around the country. And we found the average time spent with patients is less than 5 minutes, so it's quite efficient. Just a couple of news updates from the program. We've now been funded from the Department of Human Services to modify our program to be a patient-based reimbursement as opposed to just the incentive program from before. So you should be paying attention here sometime, hopefully by the end of January, when we describe to you the way in which you'll be able to be reimbursed for each patient cared for. And then also just to alert you that we're seeing 1RX, interest in 1RX principles regarding how they can be implemented using EPIC, electronic health record software for use in institutional settings. So we're pleased with how the principles of prevention and the maximal utilization of pharmacists in safe opioid use are taking root across the state. We also want to recognize the success of some of our 1RX pharmacy programs. So the old pharmacy medicine shop in Park River, Lori Larson has achieved bronze level status. Silver level includes South Point Pharmacy here in Fargo and Thrifty White number 46 in West Fargo. That's Danielle Nelson. And then gold level for Thrifty White 9 in Grand Forks, Sarah Schmidt, and then 43 in Mandan. That's Jamie Vandervorst. So congratulations to the pharmacies who are really taking the lead in this program. So with that, I'll turn it over to Amy Wermeyer.
Good afternoon, everybody. Forgive me if I sneeze or cough or have to blow my nose. I'm home with a bad cold, but with the wonders of modern technology, I can still join in and talk with you all today. I'm just going to go through a few refreshers about some of the logistics of using the 1RX program. If you haven't visited the 1RX website that can be accessed through the North Dakota Board of Pharmacy, make sure you do that. There's a listing of several resources that are there for you, available at the click of a button at any time. All of the documents that are used in our workflow are available, some of the links to places where you could refer patients if they're needing additional help from community support services, the information about how to use our RegCap data collection software platform, frequently asked questions. The bottom item on this larger list says one-to-one assistance is just a phone call away. That's also where you can access this information right on the Board of Pharmacy website, clicking on the OneRx logo that's looked, or you can see the image of it on the bottom of this slide. You can find a listing of phone numbers, email addresses to access any one of us on the team, depending on what kind of question you might have. If your pharmacy staff is going through the training and completing their final survey, and then your pharmacy is enrolled, you should be receiving an enrollment kit to your pharmacy, complete with a binder and lots of laminated and paper copies of the materials that you'll need to conduct the OneRx patient interactions with your patients in your pharmacy. If you have enrolled and you haven't received that yet, it should arrive at your pharmacy within a week's time or so after you have completed the enrollment process online. If you haven't received that, you need to let us know. Just send myself an email or anyone on the team that you can access again on the Board of Pharmacy website. We've begun sending out newsletters with updates and important tips and reminders. Those should be arriving in your inbox on the 1st of each month, so be sure to check those out. The checklist is something that was developed by one of our 1R experts, Jamie van der Vorst. A small photo of it is available on the right-hand side of this slide, but we're going to go through it in just a little bit more detail in just a moment. And then if you're here, you know that the coaching calls are taking place approximately every 2 weeks or so. And these are available by recording, again, on the OneRx website, linking to that from the North Dakota Board of Pharmacy website. The call today will be available for you to access in the future should you want to refer back to something that we've discussed. But also our previous coaching calls that have taken place are also available at that same spot. Mark, you can advance this slide, please.
Okay.
So I mentioned the checklist, also known as the OneRx workflow. So this is a guide that Jamie put together. Jamie, feel free to pop in if you have anything you want to add. That helps guide the pharmacist through how to interact with the patient using the OneRx platform. And there are 2 separate sections of this document, starting with paper-based entry. So if you're preferring in your pharmacy to have your patients complete the patient intake form on paper, then you would follow the top section of the workflow checklist. If you're preferring to have your patients complete it electronically using either their own device or a device that you're providing for them, they would scan the QR code that you've been provided in your pharmacy enrollment packet, and then they would be able to enter their information electronically. And many of our OneRx pharmacies have found that posting this checklist, this workflow guide, has been helpful for their pharmacists and the rest of their support staff as well, in kind of not having to think about what's the next step, what do I do next, but it's right here in front of you. You can check off the box if you want to have a paper copy of these printed off and available, so that if you're handing off the workflow to different members of the team, the member who's handing off can have the checklist updated as far as the steps in the process that they have completed. And this is available also on the OneRx site online. So if you want additional copies of that checklist workflow guide, you can obtain those there. And then we just wanted to take a few moments to talk about overcoming barriers that you might encounter in your pharmacy when working with patients using the OneRx program. So one concern that's been brought up by some of our participants is that they're concerned about maintaining patient privacy. So just a few things that came to my mind about this are that we can keep in mind that as the patient is filling out the patient intake form, there is no need for them or you to speak out loud about the information that they're putting down on the form or that the form is asking for. All of their data either gets written down by them or entered directly into REDCap if they're using the electronic entry workflow process. You've set that up with your pharmacy. And REDCap is a secured, HIPAA-compliant web platform, so there isn't concern about their data getting accessed by others who shouldn't see it. Use of a consultation room when you want to have conversations with patients about whatever information they have included in their patient intake form, or about their prescriptions themselves, if that's what you want to talk about them with, or talk to them about, I should say. Of course, that's ideal, but not everybody has a consultation room. And so you might think about, can you step out from behind the counter and have a relatively close conversation with that patient one-on-one? Of course, that's probably better than trying to do that across the counter. And so those are just some of the things that came to mind. When we open it up for discussion, I'd love to hear any other ideas that any of you may be using to help maintain your patient's privacy as you work through the OneRx process with them. Another potential concern that's been brought up is some hesitancy about contacting prescribers or getting their buy-in when using the OneRx process. And we've probably all had the entire spectrum of interactions with prescribers, from talking with those that are highly collaborative and having great discussions with them, to getting completely shut down when trying to ask a question. If you're feeling uncertain about calling a prescriber, I have found it helpful to think about my concern for the patient first and foremost, and to do my best to communicate with the prescriber that that's my main interest and my reason for contacting them. I think that this can help to avoid territory battles or stepping on egos or any perception of stepping on egos. I also find it helpful to put on my sort of humble hat, in quotes, and approach the conversation with questions so that I can learn the prescriber's perspective. I recently had a conversation with a prescriber regarding a benzodiazepine prescription that I was a little concerned about. So when I talked to the prescriber, I asked, I just started by saying, I was wondering about the dose of Klonopin for this patient. The patient's reporting that he's oversedated, but the record indicates that you increased the Klonopin dose today. I'm guessing there must be something that I'm missing. So I wanted to check with you to get your perspective on your approach to the Klonopin with this patient. I'm letting the prescriber know that I've detected something that doesn't seem quite right, but I'm opening the door for him or her to explain and or self-identify that there is a problem with what he or she did with that script. I'm not blaming, I'm not judging, I'm not, putting their feet to the fire. I'm just simply inquiring so that I can find out more information. The prescriber can also realize that maybe more information will be useful in order for us to arrive at the best treatment for the patient, and the two of us can collaborate on a solution. That's just my personal experience with how to approach conversations that I sometimes anticipate might be a little bit confrontational. I just try to diffuse that conflict right from the get-go by putting on my humble hat, asking questions, learning from the prescriber what I can so that we can approach it together. And finally, a barrier that may present itself is making time in a busy pharmacy. Now, this is not my area of expertise, so I'm going to invite our 1R experts to comment on this when we turn the floor over to them. I just wanted to point out a few things that we have been reported to us as the 1RX team. That electronic entry of patient information, so having the patients enter their information electronically, does seem to be quicker, both because the patients many times are able to produce that information more quickly, and the REDCap platform calculates the risk score for you so that you as the pharmacy staff don't have to take time to do that. Also, using the checklist that we talked about in the previous slide can help you to standardize your workflow so that you aren't having to repeat steps or go back and check to see if steps were completed. And posting the 1RX documents like the scoring tool and the workflow checklist in places that they're easy to see at the pharmacist or technician workstations can help with minimizing the interruptions or the needing to go back and recheck things and look them up again if there's something that you're doing not as frequently or just getting started with doing, and you're not, the steps don't seem to be right at the top of your mind every time you're going through the process. So just a few things we wanted to point out as potential tips and tricks, helpful suggestions. So we can turn it over to Mark again for discussion about the 1R experts and their lessons learned.
Yeah, I think with that, I'd like to just thank you, Amy, for getting that overcoming barriers and some tips that you've picked up on and that we've learned from some of our implementers. At this point, I'd just like to invite anybody who's on the call to, if you have any questions at this point. Now, today we looked at overcoming some of these barriers, but we're happy to have you post questions about anything regarding getting started. So right now, I'd like to open it up just for any general questions or even lessons learned if you'd like to share those. I know it can seem intimidating talking to people in a large group, but don't be afraid to post your question or make a comment. Danielle, if you're on the call, I'm wondering if Danielle Nelson, if you have any lessons learned that you could share with us.
Sure, I am here. I guess one thing that I found maybe not necessarily pertaining to these specific three um, bullet points, but like a great way of talking to the patient without like offending them or feeling making them feel like they're singled out. Is we've kind of approached it as we're just trying to educate the public on opioids. And because there's been a lot of information in the news and a lot of stuff that goes along with it, and I think it's been really helpful for us approaching patients so that they're not feeling like we're offending them or that we're accusing them of doing things inappropriate or misusing their medications. So that's definitely been something that we found helpful as far as approaching patients with it.
Excellent. Does anyone have any questions about the implementation process? Well, we have a group of individuals who have, as I introduced at the beginning, achieved different levels of status by having taken care of a significant number of patients. And they've learned some lessons. And so I'm wondering if any of our online experts have anything to share that's come up that hasn't already been mentioned on the call.
Hey everyone, this is Jamie from Thrifty White in Mandan. We have a lot of patients. I know sometimes it's hard for patients who, or to talk to patients that have been on opioids for long periods of time, perhaps years. I've had patients kind of get defensive about why we're bringing this up now. Typically, I just explain to them that because of the wide, all eyes are on this opioid epidemic. We just want to make sure, even if they've been on them for a while, even anyone who's been on medication for long periods of time, they can, get careless, or I hate to say the word careless, but maybe for, after a while they forget, oh, did I take that dose for today? Or say, like, a lot of older individuals, I ask, like, do you have grandkids that come visit you? Like little kids, or do you have pets in the house? Like making sure that you're keeping those medications locked in a safe place, and even having naloxone on hand just in case, not just for your safety, but also for your family members as well.
Excellent, thank you. Do others have patient experiences that you can share, either positive or even perhaps challenging experiences that you could share with the group on the call?
Mark, can you hear me?
Yes.
Oh, hi. This is Joellen from Grand Forks.
Hi, welcome.
I was just going to mention that we were a little hesitant when we first started with it, and we were lucky enough to have an NDSU student with us that had worked at Thrifty White in Grand Forks that had a lot of experience, and he really was helping. But I was nervous about my first one. The first one I sat down with, I just had a really good experience, and that really helped me keep going with it, is because that first person was very glad that we were concerned about their health. And, so I guess hopefully people will have a good experience their first time doing it, and then that'll kind of give them more positive to keep going. But I have heard a lot of negative things too, though, unfortunately, not at our pharmacy, but at another one.
Yeah. Is it something that you can share that we can learn from?
For the negative one?
Yeah.
I just
without not naming names or naming.
No. Yep. No names, but yeah, it's a kind of a busier pharmacy, and they get a lot of new patients, and those are always a challenge. And when they don't know the pharmacist as well, and I don't know exactly what happened, but I just know this one has had several experiences where one person told him to blank off, piss off, and another one, a lady just. I can't remember what she said, but she was upset about it. But again, I don't know what the approach was. I don't know anything about that either. And yeah. So.
Does anybody on the call has anybody had a more difficult experience that you then managed in a certain way that you could share with us?
One other thing I'll add, but not to the difficult thing, but one thing that I think I really took from the learning or the the webinar, whatever that we learned on, was using the analogy of a fire fire extinguisher. You don't want to use it, but it's nice to have and stuff. I think that really helps people understand too when you kind of explain it that way.
Excellent.
This is Sarah Schmidt. I was just going to make a comment and kind of a reminder too as well is, you know, we're doing this to help patients. And if you can remind them that we're doing this to hopefully take better care of them, it's not a requirement, obviously, for them to get their prescription. So we do have patients that, you know, say that they don't want to fill it out, and we just kind of take that and obviously still fill their prescription and still counsel them properly on the medication. We just don't have all the information maybe that we would like to have. But those patients that do get upset, my recommendation would just be, you know, we're just trying to gather as much information as we can to best take care of you.
Yeah.
Yeah, and you know, I'm not a practicing pharmacist, so I guess I'm at risk here of speaking out of turn. But you know, I think maybe an analogy that comes to my mind is sometimes as a parent, you have a teenage child come home and you bring up something and they get pretty testy or they just barge into their room and close the door. That can be intimidating and it can cause us to just sort of say, hey, give them some space for a few days. On the other hand, it can also be a chance to say something's not quite right here. How can I find a way to have a conversation here? And I think sometimes, you know, obviously, if there's somebody who's having a negative experience and even refusing to participate, we certainly don't want to become aggressive in any way. But it might be an opportunity to think of a new way or a roundabout by which to have some conversation which respects their rights as patients, but at the same time perhaps tries to open a door that might explain some of the hostility that they're having. And it might be just that they're having a bad day or that they're busy, but it's also possible that there's something else going on that's creating some of the resistance. Does anyone have any thoughts on that as just as a general way of how to support patients who sometimes are not totally compliant?
Mark, this is Amy. I think you did an excellent job of sort of using an analogy to describe a good way to think about approaching a conversation like that. And I was going to add, though I don't work in a community pharmacy, I work with lots of people who have substance use disorders. And one thing that we know for certain about the disease of substance use disorder is that it impairs judgment. And it creates an incredible sense of secrecy and desire to protect one's real actions from being discovered because that's perceived as a threat. And I have no idea if the people who became hostile were indeed suffering from substance use disorder. But I would agree with Mark that I think that presents an opportunity to try to uncover a little bit about what's behind that hostility, because it might be just a sign of the level of struggle that the person is experiencing. And I would simply approach that by asking if they could tell me a little bit more about why they became so angry at a question like that.
Yeah. This is Joellen again, and I was going to say I'd like kind of what Mark was saying too about the approach and whether it being a bad day, and either ask questions like you said or table it for the time being, put a note in the chart, and then hopefully you're the same pharmacist next time they come in and just say, you know, last time I tried to approach you about this, and I was wondering if you had time to think about it, and could we talk about it again? Or, you know what I mean? Something like that. Just, you know, try approaching them again when it maybe isn't a bad day, you know?
Yes, excellent, Joellen.
Exactly.
Thank you. Now we have some other individuals on the call, and I'm wondering if you have any questions you'd like to pose or experiences you'd like to share with us.
This is Tavia from Thrifty White Pharmacy. We actually just started doing this on the 2nd of the year, I guess. We finally pulled the trigger.
Congratulations.
Thanks. Yeah, we've done almost 20, so we're feeling pretty good about it.
Excellent.
And, you know, I think that we've had pretty good luck with it, which is surprising because we actually do have quite a large population of chronic pain medication patients. And really, we've just brought it up as a safety thing. When we were having them fill out the form, my clerk or my technician will just say that this is just a new thing that we're doing for increased safety. And nobody's really even questioned it. And then we were actually talking about it before we got on the call to try to even just also say, like, once they're done with the form, or to let them know, like, the pharmacist will actually be talking with you a little bit more about it once you actually pick up your prescription. And then during our actual counseling, even with those chronic pain medication people, because we've had a couple people that, you know, who kind of start out like, I've been taking this for a really long time. And we just say, yeah, we're just, you know, trying to raise the awareness, just because there's a lot of safety concerns about these medications. So this is kind of us starting with the first of the year to increase awareness and talk about different things that maybe we haven't talked to you about before. And that's helped, I think, with some of those people who might be more resistant or feel like they, you know, they've already heard everything or seen everything. So even just telling them about if your dose gets changed, that we have a med safe here, so we want to make sure that those medications aren't able to be accessed by anybody else, or, you know, so you can always kind of find that little thing that maybe they feel like they've heard everything or they've been on it for a long time, but, or if they have a break in taking a medication or they aren't taking their dose, that they need to be cautious to not just go back to their original dose if they had that long break, just because it's increasing that risk of that respiratory depression or things like that. So we kind of try to find those little things based off of how patients are reacting, I guess.
Yeah.
And it seems like it's going well.
Good. Congratulations, Tavia, and appreciate sharing your experience and diving in. Any other participants who would like to share experiences, positive or negative, or best practices that you've picked up, or even just questions if you're just getting started and you're like wondering about whether to use, you know, how to approach it? Anybody have any questions to share with the group?
I did have a question. Sorry, this is Tavia again, to just ask people how they're doing it, because we oftentimes have somebody maybe drop off a prescription and it has a fill date on it. So we have been trying to have them still fill out the form at that time, but it's kind of been a tricky thing to document and like transition then when we actually are going to counseling them on whatever day they can get it filled. I don't know if anybody else is having that experience, or I mean, we have some screens in our profiles that we can put information in to try to have it there when we go process it to fill it, but we're just curious if anybody else has encountered that or what they've been doing.
This is Jamie from Thrift Away in Mandan. I guess typically, because we have patients that also bring in prescriptions with specific fill dates, typically I throw the paper form into the bag when we fill it, just so that the clerks see it, so that they have them fill it out when they come pick it up. And then usually if it's for long-term or long-term opioid patients, usually I'll do it once every couple months for them, since they're pretty familiar with it, and it's kind of a form that they would have to fill out every month. Is to them kind of seems like a hassle.
Mm-hmm. Good, thank you, Jamie. Any other questions here? We have a few minutes left. We can entertain any other questions people might have. Well, I appreciate everybody's participation today. And you might be asking, where are we going with this? Well, we feel like we've got a couple of things that this program is leading to. One is that this year, as I had mentioned at the beginning, we'll be offering an opportunity to be reimbursed on more of a per patient basis. The criteria for that will be clarified later, but that's something that I hope will be an increasing incentive. And the purpose of that is to have more evidence this year that we can then bring to third-party payers to seek for that kind of reimbursement across the board. So really appreciate all of you on the call and all the other OneRx implementers, because you're providing the evidence that we need to be able to make a case for the importance of caring for patients who receive opioid prescriptions in this manner. The other is, I think we are also trying to increase the recognition of pharmacists in terms of the cognitive services that pharmacists deliver, and that should be recognized, valued, and paid for. And so I hope that this also can be an opportunity to branch out even into other areas where pharmacist cognitive services are recognized as being of added value and cost savings. And so we're hoping that there's also crossover from the 1Rx program into broader understandings of the role of the community pharmacist in providing lots of different services to patients besides just dispensing. With that, we'll be wrapping up our call. Just remind you to celebrate your success and different ways. Send us emails if you have anything you'd like to share. We have an active Facebook page, and I would invite you to like the Facebook page and follow that. We post stories and photos of activities, as well as just staying in touch with us. So thank you for your participation today, and look forward to touching base with you again at a future call. Goodbye.
Bye.
Thank you.